Hi, I'm Kelly Wright. This is The Resilient Grove. This is a gathering place for honest conversations about healing, resilience, and the courage it takes to grow through life's hardest seasons. Let's take a moment before we begin. I invite you all to join us. Close your eyes, take a deep breath in, and a deep breath out. Make yourself comfortable, and let's get started. Looks like I'm going to interview both of you. Today we have Jackie and Buckeye together. Okay. All right, ready, puppy? Well, hi, Jackie.
Kelly.
Welcome to my podcast.
Thank you.
Make yourself comfortable.
I'm uber comfy.
I know. All right, let's start with scratch that, redo. I need to rephrase that. Okay. All right, ready? Hi, Jackie.
Hi, Kelly.
Looks like I'm interviewing you and Buckeye together. One of my favorite things about you is how much you advocate for humans, for our bodies, for just being human. And that's one of the things that drew me to you, is how not only knowledgeable you are, but how you just want to help people get out of pain.
Thank you.
And you helped me get out of pain. So that's kind of why I want to do this podcast, because I know that you can help other people out of pain too. But
I hope to.
First, let's talk about who you are and how you got into PT. Well, go ahead. You're a DPT with all the letters after your name.
I'm a DPT. That means I was actually just explaining this to a few people yesterday. So I'm a DPT. That means I got a doctorate. Nowadays in our profession, if you become a PT, you are at a doctoral level.
Yeah.
And then the PT after my name means that I've passed the licensure for the state. So it's PT, DPT.
Okay. So what led you into PT?
So back in my undergrad, basically when I had to, establish my major, I literally went off the School of Health and Rehab Sciences website, and I was like, what classes do I have to take per major, and what sounded the most interesting?
That's exactly how I chose OT.
Really?
I looked at PT and I looked at OT and what classes could I do that I would enjoy. PT had a lot more math. PT had a speech class. And I didn't want to do any of that.
Yeah.
So I chose OT.
Yeah.
Now, fast forward, OT is more me, because then I was able to pursue yoga. I don't know if I would have pursued all that if I was a PT, right? I would have probably gone down.
Or it would have been a different
mindset.
Yeah.
Right, exactly. Yeah. So, but are you athletic training too?
So I chose athletic training as my undergrad. And then from athletic training, it was kind of like, well, what do you do now? And the reality of athletic training is that, so I went to University of Pittsburgh, and the reality is I think I just touched his penis.
You what?
I think I just touched his penis.
Did he really?
No, I think.
Oh, you did.
Anyway, the reality with athletic training is that when you graduate from school, and I was at a D1 school, University of Pittsburgh is Division I, so we get a lot of money for athletics. So you get a lot of supplies. You have this beautiful athletic training
Was that
room.
the goal that you wanted to do, was work with athletes?
No.
Okay.
No, again, I chose athletic training because I was based on my classes. Honest to God, I didn't know what an athletic trainer was.
Huh.
So from athletic training, it was kind of like, well, the reality is a lot of people most likely go into a high school setting where you work in a closet and you don't have enough supplies, and you're just worked for long hours and long seasons, and that just wasn't what I wanted in my life. So
come on, you're taking all the attention away from Jackie. Come on. Okay, so let's talk about, were you always into more holistic ways, or is that kind of something that just evolved naturally? So
my beginning career with being at a nursing home, I think my holistic approach, I think, stems from who I am and what I need and seeing, right? But I saw working with, geriatrics, that they are so, because they're in the healthcare system and it's so pharmaceutical based, and it's not, they're so acute, so they don't have they don't have the time to manage their symptoms and their issue. So because they're acute, they're in the pharmaceutical world with pharmaceutical treatments. And I just saw that, like, the changes that has on their body, and how so much was lacking, and how they could don't eat my bar.
No.
That could have, that, you know, if these patients had a more holistic approach to their healthcare throughout their life before they became sick, I think things could have changed.
Yeah.
But also in their sickness, having
you
a
had been
holistic
young
approach.
when you were working there, no?
I was there, so I graduated PT school, I was 27.
So to be that young and to see that, I mean, that took me a long time to see that in the medical field.
Oh,
what you
you.
saw. So props to you for seeing that so early.
Thank you so much.
That was why I left the medical field, is because it was just so not set up to help patients heal and move forward and actually go home and live. It was set up for them to just be frequent flyers, to just keep coming back and needing more help.
Responsive versus preventative.
Yeah, right.
Responsive to your illness. Yeah.
Right.
Yeah.
So on that note, somebody told me I say on that note a lot, so I have to like try to think of a new way to say it. But anyway, on that note, you mentioned how you're treating people. I did some research on your website. You treat people as individuals and not, like as in the medical field, as one algorithm. So what does that look like so you're no longer working in facilities. You're doing...
Rarely. I might get a PRN job here and there and I'll help out. I do love geriatrics still, but...
Same, I do too. But you do most of your work one-on-one client.
Yep.
So how do you take that approach, what you just talked about, not fitting that person in the algorithm of the medical world, but actually treating them as an individual human?
I think what I mean more so by treating them as their own individual is that, you know, granted, a lot of the people that I see me because of a pain or some kind of symptom physical in their body, right? So because of that physical symptom is on the spectrum of pain, right? Pain itself is a very complex concept, and so much of pain depends on your psychological standpoint, and everybody psychologically and physically are different. And one grade 2 hamstring strain might be and present completely different to a person who looks the same body, but psychologically is different. And it's just that you have to realize that some people don't respond to this intervention, and it's not necessarily the physiology of the issue we're working with. A lot of it's psychological and back and forth.
And that's not something that you would get in the mainstream medical world.
Well, in the medical world of physical therapy and insurance coverage, you just do, and
and you follow the. I took a 10-year break from therapy. And I thought when I got back into it, it would have been evolved and it would be something new and I would have to learn it. And I remember the director that hired me and she said, oh, it's like riding a bike. You'll know right away. And I remember looking in the gym and thinking, oh my gosh, it's the exact same stuff from 10 years ago. Nothing had changed. And still today is the same, like for OT, putting the pegs in the pegboard. People still do that. To me, I can't even understand how that is functional at all.
Yeah.
And so nothing has evolved or changed in the medical world in that aspect of it.
Yeah.
So that's kind of what pushed me out of the medical field, was because you have to treat people the way that you just explained. They don't all fit in the same box.
Yeah.
And so it was just doing everybody a disservice, and it was tough for me ethically. Okay, so let's talk about what you do now. So go ahead and just give me the rundown of what are those techniques that you do? So
I started my company, PhysioFit and Wellness, and I work with active individuals. And like I said before, generally speaking, if you want to make the most the easiest way of saying this is that somebody who has pain or some kind of physical symptom, they'll see me, and I, to treat their pain, use a lot of dry needling, cupping, manual therapy, and then I follow that up with showing some exercises to, you know, I hate using this term, but realign or coordinate the muscles so that you can have better alignment, better stability, and reduce your stresses on your structures that could be causing you pain. Why do you not like saying realign? Because I think in the client's eye, when they hear that they're malaligned, it's more of a response that like, oh, this is wrong. That it's like, yeah, something might be a little bit off alignment, or you might see something on your imaging, but again, the the amount of that alignment or malalignment doesn't necessarily correlate to how bad of the pain you're going to have. So don't worry about it. Just, sure, something's a little bit screwy. We'll take care of it.
I had the same situation at Stretch Lab. A lot of people would come in and they would say, "Is there something wrong with me?" No.
Yeah, it's just, yes.
I mean,
you're fine.
You sit at a job all day. Like, your life circumstances are not ideal for the human body. There's nothing wrong with you, right?
And I think a lot of practitioners come in with the approach that, this is wrong, this is wrong.
Yeah.
And I know that, in a session, I do have to show the dysfunctions that we kind of have to fix.
Yeah.
But again, the fact that you have some of these malalignments doesn't necessarily mean that's what's causing your pain. So don't get caught up on these terms.
Yeah.
And that's why I don't like using it, because it's the response to the client is what I...
So for me in yoga, well, you can relate to this. In yoga, I don't like saying how you're supposed to look like in this pose. Like, I had this guy today say, well, I can't do it the way you do it. No, you do it the way it works for your body.
Exactly.
Like, so if you say you're not aligned, well, in their body, they might be aligned at that moment, right?
Right.
So I don't like saying, oh, there's a true alignment for every yoga pose, because it's just whatever the body can move.
Exactly,
right?
yeah.
So yeah, I get that. What's manual therapy?
So manual therapy is anytime I'm using my hands on somebody. So whether it be soft tissue release, joint mobilization.
Okay.
I guess you can it depends on how you're billing it, but I manually move people as they're moving. They can resist me, and I, do like a trick on their muscles.
That's one thing that I was so fascinated by. And as much as I know about muscles in the body, I still don't know a lot. And watching you work on my body, like the way you had me move to isolate, to figure out what was wrong with me, it was fascinating.
Thank you.
It was just fascinating.
Thank you. The body's pretty cool.
It is. And not only that, but that you can know what's going on just by doing all of those movements, and then you isolate it to the right muscle that needs help.
Thank you.
So that's why I'm doing this, is because I'm like, gosh, you've helped me so much. I've got to share you with the whole world, right?
Thank you.
So, okay, so let's start with cupping. I've never done cupping, so go ahead and start with...
You've never been cupped before?
No, I've never been cupped. No. I've been needled.
I know that.
No.
Okay, so
I, to be honest with you, what I've seen online makes it look really scary, So
cupping's not bad. It's literally your whether it be one of the more silicone cups, or they have plastic ones that you connect a pneumatic device to. I don't want to say gun, but it's a pneumatic that you kind of press the trigger and it sucks the air out, so that connects the hard cup onto you, or the silicone.
Okay, so it's suctioning the skin and the muscles up?
Yeah.
Okay.
You put the hard cup on, and then you connect this little gun thing, and you trigger it, and it pulls the air out.
Okay.
And then there's this little device, I don't know, an engineer would know what it's called, like a turbine, I don't know what it's called. But anyway, it keeps the vacuum in that cup.
Okay.
Or you can use a piston, I don't know what it is. Anyway, you can use a silicone cup where you squeeze it, put it on the skin, and then release.
So the concept is to pull the muscles up?
Yeah, it's pulling tissue, yeah.
And what is that?
So some people are saying that, well, first and foremost, I have not taken a class on cupping, so I am not privy to the newest research on what it might physiologically show in the tissues. However, I will say that some people say, oh, is it bringing blood to the surface? Yeah, because you get that hickey, right? I say that it kind of is, it's one of the only interventions I could use that is pulling tissues away from each other. If I'm doing manual, I'm pressing tissues together, but we need to
almost separate them,
kind of separate and allow fluid and nourishment to go between all your layers.
So give me a situation where you would do cupping on someone.
Tightness. Any areas
Is it mostly done on the back?
Back, pec, sides of the ribs, hips, front of the knee. I mean, literally
really? Anywhere?
Yeah, anywhere, just not over your carotid artery. That's what I say. But here's one of the things that I think a lot of people, or the layman, doesn't discuss with cupping, is that there is a nervous system response that kind of just the calming, the proprioception of that area that we're, opening the tissue, that you feel it, right? Is your tissue literally releasing and opening? Maybe not, but just that sensation. And then that kind of creates relaxation that allows you to connect, better awareness when you're doing an exercise.
How long are you in a cupping session for?
I rarely have somebody only get cupped. Like, that's the only thing. So if I leave a cup on somebody, it's gonna be based on how their tissue's responding to it, their pain level. If I have the cup just sitting there, or if I'm moving the cup, or if, let's say, I put it on their pec and then they perform an exercise with it, you don't have to have it on there to get the bruise to have the actual benefit of it.
Okay.
So a lot of times, if I have a cup on somebody and it just sits, that would be for somebody who's very symptomatic, very high nervous system. They need to relax. And I literally just want them to calm with a sense of touch on them. Rarely do I do that, because I feel like that's something that they could just do to themselves at home. And I feel bad if I'm taking up their time doing that, right? So what I do with a static cup is, generally speaking, I'll put cups on and then I'll needle around that area if that area allows for it. So it's kind of like a dual. But then again, some people respond to cupping and they don't want needling. That might be a reason why I would just do a straight cupping session.
So let's talk about dry needling. So that was something that I had had acupuncture in the past before, and I was fine with that. But I had heard of dry needling through the clients that I had at Stretch Lab, and I was like, what is this dry needling? And they would tell me, and I was like thinking like these long needles, right? And I was like, no, thank you. And then I met you, and I was like, I had just started having that hip pain. And I was like, I'm like, I got to just try it, right? Especially when you did that one when we were at your house, and I could feel it relaxing. Oh, no.
That was in your neck.
Stiff neck. Yeah. That's right. I had my stiff neck, and it was instantly you helped me. And so by doing all of these dry needling things, I become a believer, because not that I was a skeptic before, but it was probably more fear-based, because I didn't know what it would feel like, right? It's not like giving blood or getting your blood drawn. It's not like that type of needle. So go ahead and talk about dry needling.
So what you just said, it's not that kind of needle with giving or taking blood.
Yeah.
It's a pinpoint of a monofilament needle. So there's no hole in it to take or give blood, like how a nurse would take your blood, right? So it's just a monofilament. And
how does that penetrate through the skin then? Obviously it does.
Yeah, I guess the shape of the
just
edge
goes right through the skin.
Yeah,
okay.
And then I guess the force that when you tap it in, it'll,
Okay.
But very, very thin. And as I've practiced more and more, I don't have to, I apologize to my old clients that you
That was one of my questions, is like, have you had to have a trial and error with humans?
Well, so when you first are learning how to, not only are you physically using the needle as a treatment, but the therapist, you're also feeling and getting information back as you're using this needle. Okay.
From the muscle you're talking about.
Yeah, from the muscle or the tissue. And and you also have to direct it. And as you get a thinner needle, it's harder to direct, it's harder to work with, it's a more advanced way of needling. So in my earlier days, when I needed a thicker needle, it's a little bit more uncomfortable. However, there is a better benefit that it causes a bigger traumatic lesion. So that is a better dosage, right? But that's just to say that I could have used a few small needles instead of one big. And it's not that huge of a difference, but, so anyway.
Your attunement has gotten better since you've been practicing it more.
Oh yeah.
And do you notice a trend, like all humans tend to have the same issues? So what may work on one human works on another human?
There's a lot of pattern. Yeah. But sometimes my mind is blown away, and what I thought would work is, are you serious?
Really?
Yeah.
So you're still shocked too, huh? Okay. Well, all of that, cupping, dry needling, can be very intimidating to people for two reasons. Fear, because they don't know what it's like, and it's a newer, holistic measure of treatment. How do you handle people who are, just unsure of it, or that's too much for me?
Yeah. Well, all my clients, I always give them the opportunity to have a discovery call, and we discuss what I could do, how it could help. It depends on the client. I have some clients that come in and they're like, you will not put a needle in me. I will pass out if you put a needle in me, I swear. And that's fine. Then we'll do something different. A lot of people do have fear. I have some people with tattoos. who are afraid of me needling them. I mean, there's so much variety in who I treat and their response to the needles.
But because you hear needle,
yeah, you get this fear.
associate it with the needle of the medical field, right?
And I tell a lot of I tell most clients that I'm needling, the sensation that you feel with the needle is not necessarily pain. We all associate a needle with a shot as a kid being painful, and we cry, and that's like our nervous system response. But
it's that bracing feeling of like, okay, a needle's going in me, right?
And there, depending on where it is, I have some people that are like, I didn't feel a thing.
I never felt a thing.
Yeah, some people just don't. And that's also who the person is coming to see me, with their nervous system. Some people, I say, this one isn't going to hurt. You're cool in this area, and it's like, oh my God.
But to me, like, it didn't hurt the needle going in. It was when you hit the muscle.
If you get sometimes if you get like a twitch response, or you do get that dense tissue, I say to my clients, because I was like, ow. And I'm like, are you sure? Did that hurt? If it hurt, fine.
Yeah.
But did that hurt, or did it surprise you?
Right.
You know?
And I don't think I've ever said ow, but it was just like, whoa, what was that?
Yeah, it's your first response to but sure, sometimes it does hurt. Sometimes I could, if there's like a really, really sharp sensation, I could be next to a nerve that is specific to receiving and telling your brain that there's a pinprick sensation.
Yeah.
Well, we know your body is working right? If there's a pinprick and I'm stimulating that nerve. But a lot of the times people are really surprised that the stress or the quote unquote pain from receiving the intervention is just overridden by the...
I have never felt pain from the needles, or pain after the fact, or any red marks or any bleeding. I've never had any of those types of reactions.
Yeah, and then but you feel the response, and you're like, oh, wow.
I couldn't believe it. Yeah. And I wouldn't have said anything. You noticed that I had a stiff neck, and you were like, what's going on with your neck? I was like, oh, I think I slept wrong. And you're like, lay down. I was like, okay.
Let me stab you in the neck.
That was just wonderful, because it was like, you're not working, right? It wasn't a session. You saw me in pain, and you wanted to help me. Yeah. Like, that's just the beauty of you.
Yeah.
Right? Yeah. So let's go back to, how does dry needling help? Like, use my stiff neck as an example to how that dry needling helped with pain.
Okay, so there's three in the training that I have. There's different schools or educational companies that can give you your training for dry needling. The training that I've gone through is called Integrative Dry Needling, IDN. And they are more of a nervous system type approach to dry needling. So a lot of people associate that dry needling is specific to taking a needle and putting it into a trigger point, right? Sure, I could do that. I can take a needle and put it into dense tissue. However, there's also a benefit.
And when you say dense tissue, you're talking like muscles that are like all tight.
Yeah, that I feel that you are saying, oh, this is really tight.
Like a knot, yeah.
Yes, a knot.
Okay.
So yes, you can address that area. So the dry needling, the effect from the integrative, the IDN, is we get a local response locally to that tissue that I'm putting the needle in. The needle is, for lack of better terms, cutting that tissue, creating bleeding, and then through the inflammatory process is going to take away some of those bad inflammatory markers that are telling your brain you're in pain. They're helping clean up all the caca in the blood, in the fluid around there, okay? But then what we do with our method is we take the muscle / nerve that's feeding that muscle, and we trace it back to the nerve root that it comes from. So let's say we're doing your quad, then we're going to take that back up to your lumbar spine, or like with you, we were doing some traps, so we took it up to the level in your cervical spine. And then by putting a needle in that area, granted, I do find that there are muscles that, again, respond with a local response, but a needle in the paravertebrals creates a pain modulation response that is more of how the brain reacts to pain.
Wow.
But then there's more. So then we also take a homeostatic point that's associated. So not only if you're coming in for your knee pain, I'm going to treat your knee, we'll go to the back, and then I want to find a homeostatic point that is still local to the area that's in pain. So for your knee, I might take your IT band or your saphenous nerve. And those two areas then are associated with your greater nervous system. and they start to shift you homeostatic for homeostasis. They shift your nervous system into more of a parasympathetic because we're all jacked up in our fight or flight or our sympathetic. So it kind of calms your nervous system. So then your threshold to receiving pain, instead of having a really low threshold and, ooh, that hurts, we're taking that threshold, we're putting it higher, so that little bit of stimulus isn't going to affect your body as if your nervous system was riding in sympathetic.
So on that topic, no, I was just going to say on that note, do you have to work with people as far as like what you just explained? That's not just like a lay on my table and I'm going to fix you. Like you have to really like move the body and figure out where it's coming from.
Yeah, and I'll do an assessment to do that in my first session, my initial assessment. I forgot
you did do that, yeah.
But then every time that you come in, I'm going to reassess and see where that stickiness is, or that, you know, that lack of motion, that lack of fluidity, or, you know, where your pain area is.
That's fascinating, Jackie.
Thank you.
Okay, so one of the things that you had mentioned to me is, in my own reactions, like you love seeing that aha moment that your patients get or your clients get.
Yes.
So you had made a comment one time that you wish you could videotape it.
I say
and
that
then you
to
could
everyone.
put like a compilation of everybody's aha moments. I really think you should.
I say it to everybody who I have for their first time, and they're like, pardon my French, holy shit, like, oh, that's wild.
Yeah.
I mean, the responses I get are just like, it is unbelievable how dry needling, granted, it's not for everybody. Some people are like, no, it didn't help. But for the majority of the people I see, oh my God. And I'm one of those people too, so I know that feeling. Yeah. But then to see how they then move afterwards.
I know. And to just make people feel better.
Yeah. I mean, it's just, and it's awesome. It really is awesome.
So I guess it's the own video that plays in your mind is all the aha moments. So go on that topic of what it doesn't help with some people.
Yeah, some people. Well, and you know, let's put it this way, and it could be a multitude of things, but what if I am treating somebody who at home drinks a lot, smokes a lot, eats really poorly, they have a lot of trauma they're going through, they have chronic pain, so their system's been jacked up for a long time. I mean, and they have a really stressful job that they go to all the time. I mean, that is the reality for some people. And again, holistically, me putting a needle in your body, thank you for thinking I'm a magician. Yeah. Thank you so much for trusting me.
That makes total sense.
There's so much more that's going to be something that's going to help you with your pain.
Okay. So does that happen, like, out of the course of all your clients that you've had, like, what do you see a ratio of people that it helped versus people that it hasn't helped?
Oh God, I mean, the majority is who it helps, you know, but there are times where it's kind of like, you need a multifaceted approach with more people, more hands on you. Yeah. And you as a client need to devote more time to this.
Yourself. Mm-hmm. So let's go back to manual therapy. So you got massage therapists, chiropractors, all these people doing manual therapy on people, right? Which I've had many of that too, and it works great. Talk more about that. For what you had mentioned, like joint mobilizations, just kind of loosening up the joint to get more freedom of motion. So go ahead and talk about all of that.
So I could do soft tissue massage, like myofascial release. A lot of times I could do like a pin, like hold tissue down and stretch and kind of, again, I'm not taking the tissue, and truthfully, the response is that it's not going to lengthen, and point A and point B are going to be further away than they were before. It becomes more of a nervous system response, and then you can then perform your exercise better when you're not as restricted and your muscle isn't that tense. So it's
so by doing that manual therapy, then what's the concept behind of how you're getting that nervous system reaction? Is it the touch, the blood flow, all of that?
It's more so the touch, I would say. Oh, that's a hard question to ask.
We can revisit that another time.
I like that answer.
Okay. All right, so we're going to segue now to how buff is your muff?
Girl, I got a buff muff.
Let's start with how you created How Buff Is Your Muff. Well, so you were talking about the dry needling, the cupping, all of that.
Yeah.
So How Buff Is Your Muff was born from...
So how buff is your muff? So when I see clients, I take care of their pain most likely in a passive way of dry needling, cupping, manual, something. But then you have to teach the body how to move after you've given that freedom, right? So my corrective exercises that I give are based off of the core starting and supporting, so then you can move, you can then move your arm and your shoulder. You can then move your hip appropriately. You can then move your foot appropriately. So the way that I approach movement with everybody is that, first of all, on a nervous system level, if your breathing is jacked and you're all chest breathing, that's gonna affect how you move, where you move, your pain. But it's also going to disrupt your proper alignment and connection of your muscles to turn on those muscles appropriately for stability, right? If my ribs are all flared up like this, it's gonna put a lengthening through these tissues that they're not meant to be in, and it's gonna be harder for them to contract to give me stability. Tissues in the back are gonna be more tight. So a lot of the approach that I come to people, whether it be a shoulder, a toe, or plantar fasciitis, is I get their core and their essence of their body aligned, so then everything else can move better. Okay, so with that, and I think that's because of the classes I've taken, the classes I've taken, and the way that I move and I see movement helping me. So a lot of those courses that I've taken are women's health, pregnancy and postpartum, pelvic floor, low back, hips kind of stuff. So with the classes that I've been taking, I've just been so surprised with all of the education I'm getting. So I created How Buff Is Your Muff, which is a workshop of basically, it's tailored to women. I've had a few men come before, and it is helpful for men because yes, men have pelvic floors. But it's a workshop tailored for women that is basically, hey, here's your anatomy. Here, we call it a pelvic floor workshop, but the thing is that the pelvic floor doesn't just function by itself. So you need so much more of the body and core to work together. So it's, hey, here's your anatomy of, your pelvic floor, but here's also how the core, the ribs, the back, the hips plays into that. Here's what pregnancy did to affect you. Here's what society did. Here's what a normal asymmetric person's posture looks like, and how all these things can then create the common symptoms for women are pelvic organ prolapse, leakage when they're sneezing or jumping or laughing, back pain, hip pain, tightness. So it's just kind of,
as some of these people don't even realize it's coming from the pelvic floor.
That the pelvic floor is a part of the solution. Yeah. So I think I call myself a women's health therapist, not a physical therapist. I'm sorry, not a pelvic floor therapist. I don't do any internal work. And I think a pelvic floor therapist is, don't get me wrong, they see clients holistically, but they also are specific to the pelvic floor. And I see how the body functions with the pelvic floor as a huge component that's overlooked by a lot of other people. So
that was my next question is, how does the pelvic floor, go ahead and explain more about how the pelvic floor and the core function to keep the whole body mobile.
So the pelvic floor, I don't want to say connect, like has a actual point A to point B connection, but the pelvic floor functions with the diaphragm, or your main breathing muscle. So we have to have the diaphragm in a proper position to function, to then let the pelvic floor function. The core is going to help position the diaphragm. So if we don't have any of those components for alignment to turn on those muscles, things can be awry. If those muscles don't, even if we have the alignment, but those muscles don't function appropriately, then we're not going to manage our pressure. And when it comes to leakage, prolapse, pain, whether it's that you're bending over to get something in the cabinet or you're deadlifting 200 pounds, it's a lot of times correlated to your management of your pressure in this core system. So are you contracting enough to respond to the weight that's being put on your body? Are you managing your breath to adjust the pressure which is in your system? Are you holding your breath and you're pushing it down to create that urine leakage or to create that prolapse? Is your pelvic floor alive enough to be able to respond against that? So everything has to work.
So I'm thinking right now of all the women I've known that have had the prolapse surgery, right, where they put the net in, right? has any doctor ever just described to them what you just described? Probably not. There's a technique when you go to the medical field. This is what we treat leakage and prolapse issues with.
Yeah.
And then the women go home and they don't learn anything about their bodies, and it happens again, and they have to go back and get it fixed.
Yeah.
Jackie, why doesn't everybody know about you?
I don't know. Spread the news. Spread
Seriously,
the word.
everybody, Jackie can help us.
Make your muff buff.
Yeah, so, okay, on that, let's talk about some simple exercises and daily things that we can do to buff our muff.
Number one, let go of your glutes. So many people are clenchers when they're standing. They like thrust their hips forward, they're tight.
Do they think by squeezing the butt makes their pelvic floor strong?
Either squeezing the butt, squeezing the pelvic floor. This is what I tell people. No muscle wants to be on 24/7.
Yeah.
Like, I'm not going to give you a 10-pound weight to carry in your bicep all day. Your arm's not going to be happy, right?
Yeah.
So let go of your pelvic floor. Strong doesn't mean overactive. We want a strong pelvic floor. We don't want an overactive, tight
And
one.
overactive would mean people who are just like clenching it, trying to strengthen it that way.
Yes, yes.
Okay.
Or just neurologically turned on.
Yeah.
So relax. A lot of people, when it comes to pelvic floor work, a lot of people are overactive in their muscles and they need to relax to then be able to connect their mind to their body. That would be number one. Number two is learn how to breathe. You have to breathe through your diaphragm. You have to breathe 360. We are so rib flared, whether it be from pregnancy. I see so many men who have rib flare.
It's from improper breathing, posture.
Improper breathing and posture, and lack of awareness of how you're supposed to hold yourself, you know? So learn how to breathe properly. And with that being said, what can you do? You can go on YouTube and look for guided breathing. And just
go to yoga
connect
class
with the breath.
Yeah.
Connect with how your body breathes, because you have the control to your breath. And so many people are like, oh my God, I didn't know I breathed this way. But you have the power to connect to your breath to then be the driver of so much movement. And then, let's do one more.
Okay, so relaxed, learn how to breathe.
And just mobilize, just get up and move. Move multi-directionally. Lay on the floor and flop around and flop in all directions.
Move multi-directionally. Yeah. And more planes than just sitting and standing.
Yeah. Sit, stand, roll.
Yeah.
Bring your arm this way, bring your arm that way. Bring it up, bring it down.
Cross.
Rotate it this way. Yes.
Yeah.
Move so many different ways.
Yeah.
And I like to use the term explore. Explore how, if you change your motion in this little degree, how that changes things. Is your right side different than your left side? So to really change, I encourage people to connect with their body.
I like that. So let's tell everybody where we can find you.
I'm on Instagram at physiofit.cle. You can send me an email, physiofit.cle@gmail.com.
What's your website?
physiofitcle.com.
Okay. And then you do private clients?
I see private clients. I only see clients one-on-one. I don't do anything virtual. So I'm local here in Cleveland.
Okay. And no insurance?
I do not take insurance.
I
No.
love that. Okay.
Yeah.
Thank you, Jackie. This has been lovely. I could talk to you for hours.
Thank you for inviting me.
All right.
I
Have a
enjoy
good
myself.
day.
Bye.